Hi guys, I'm Dr. Lisa Januskey and I'm the owning optometrist over at Precision Eye Care. February is National Macular Degeneration Awareness Month, so we're going to go over a little bit more about this disease. So, before we can talk about what macular degeneration actually is, you first have to know what a macula is. The macula is the part of your retina that has the highest concentration of cones in it. The cones are the photoreceptors in your eyes that are responsible for changing light information to electrical information, which then gets sent on to your brain so you can process what you see. In macular degeneration, what happens is that these cells experience oxidative stress and they start to degenerate and die. The reason this is very important is that macular degeneration is the leading cause of blindness in Americans over the age of 60, and it's a major cause of blindness worldwide. The symptoms of macular degeneration are blurry vision, distorted vision, loss of color vision, and seeing either a black area or a missing area in your central vision. Macular degeneration affects 11 million Americans, and this number is expected to double to 22 million by 2050. There are two types of macular degeneration. There's a dry form and a wet form. The dry form is the form you develop first and it's less severe. There's no bleeding in it. And dry macular degeneration accounts for 90% of people who have macular degeneration. The wet form is where there's bleeding in the back of the eye, and although only 10% of people with macular degeneration have the wet form, it makes up 90% of the blindness cases. Macular degeneration has a lot of risk factors associated with it. The most important risk factor is age, because 30% of people aged over 75 will go on to develop macular degeneration. The second most important risk factor is smoking. If you're a smoker, please stop now because your risk of developing macular degeneration goes up 2 to 5 times compared to a non-smoker. The third most important consideration is obesity. People with a BMI of 30 or above are twice as likely to develop macular degeneration when compared to people with a lower BMI. What goes along with that is people who have a sedentary lifestyle. They're more likely to develop obesity, therefore they're more likely to develop macular degeneration. Diet is also important when it comes to macular degeneration. People who are eating foods that are high in saturated fats, high glycemic indexes, high in cholesterol are more likely to develop macular degeneration. Likewise, people who aren't eating foods high in antioxidants like green leafy vegetables are also more likely to develop macular degeneration. Having high blood pressure influences the amount of oxygen that gets to your eyes, so high blood pressure is another factor. The people that macular degeneration tends to hit are females, people with a lighter complexion, people with lighter colored eyes, and people who spend a lot of time outdoors in the sun because the blue spectrum of visible light is known to contribute to macular degeneration. The progression of macular degeneration can really vary. The dry form of macular degeneration tends to move slowly, and on average, the American Optometric Association estimates that it takes about 10 years for someone with macular degeneration to move to legal blindness. Now, it is possible that the dry form can quickly morph into the wet form, and with the wet form, if there's any breakage and leakage of the blood vessels, then you can lose your vision in a matter of days. When you're diagnosed with macular degeneration, your optometrist will give you an Amsler grid to help you monitor the progression of your macular degeneration. And what you do is you cover an eye and you look at the center dot of the grid. And without moving your eye, you look to see if any of the lines are missing, wavy, or distorted. And if so, that's an indication that there's been a change and you need to see your eye doctor much sooner. Unfortunately, there is no treatment for dry macular degeneration. However, there has been research that shows that taking lutein and zeaxanthin helps slow the progression of the dry form from the intermediate stage to the advanced stage by 25%. The good news is that the wet form may respond to intraocular injections or laser treatment if it's detected and treated soon enough. To reduce your risk of developing macular degeneration, don't smoke, and if you do, stop. Get plenty of exercise. Whenever you're outdoors, wear sunglasses, even if it's a cloudy day. And then make sure that your diet is low in sodium and high in antioxidants. Eat foods like green leafy vegetables, berries. That will help give your macula what it needs to stay healthy. All right, guys, that's macular degeneration in a nutshell. Thank you so much for joining me today. If you have any questions, feel free to post them in the comments section or give our office a phone call at 979-985-5305. Wishing you healthy eyes and great vision. Bye-bye.